Hello, I'm Andrew Riley. I'm an associate professor of pediatrics at Oregon Health and Science University, and I'm happy to tell you a little bit more about our new article in the Journal of Developmental and Behavioral Pediatrics called Parents' Consumer Preferences for Early Childhood Behavioral Intervention in Primary Care. I do want to thank the Agency for Healthcare Research and Quality for their support of this work. We know that promoting safe and effective parenting practices early in childhood, particularly when it comes to child discipline, is one of the best ways to prepare children to be successful in life and to prevent poor outcomes like child abuse or neglect. We also know that while parents want to get behavioral guidance from their primary care provider, they often don't. It's the number one unmet need reported by parents when it comes to primary care. So we wanted to figure out, well, what do parents really want? What are the behavioral topics that they're most interested in? And then how would they like to see that information delivered? So we conducted a survey of about 400 parents at 5 different primary care practices in the Pacific Northwest. So these are parents of children between the ages of 18 months and 5 years. And we asked them first, what are the behavioral topics that are important to them and what would they like to see covered as part of their child's primary care? And then second, how would they like that information to be delivered? Would they like it to be part of their normal visits? Would they like it to come from their primary care provider? Or perhaps would they like to talk to a behavioral specialist either during that normal visit or over the phone? We asked them about a variety of different formats. What do parents want to know about? Well, the most common things are what we might have expected and are related to disruptive behavior in early childhood. There are things like tantrums, coping with difficult emotions, aggressive behavior, learning how to calm oneself, etc. But there's another category of behavioral topics that parents were also quite interested in, what we called healthy habits, which are things related to picky eating or developing good sleep habits or toilet training, things of that nature. And overall, 96% of parents, so almost everyone, rated at least one topic as an important part of pediatric primary care. Now, how do parents want to have that information delivered? Well, by far and away, the most preferred option is to talk to their child's doctor during routine visits. The next most preferred option is to talk to a behavioral specialist also during that routine visit. So there seems to be an overall preference for behavioral guidance delivered during routine care. After that, you can see that it's a bit of a mixed bag. Some parents are more interested in separate visits. Some are more interested in media type resources, whether it's digital media or books or handouts. So in conclusion, almost all parents want some behavioral support in pediatric primary care, but exactly what they want, both in terms of information and how that information is delivered, can vary. It's important that we have a spectrum of interventions so we can meet the needs of different people. I want to thank you for your interest in this study, and I hope you'll check out the full article. There's a lot more in there, including how socio-demographics, parenting characteristics, and child behavior problems relate to these preferences. Thank you.